Does presumptive mean you don't need the Nexus, the magic Nexus link?
Essentially, that's what it means. You need an in-service event, a diagnosis of what you're claiming in most cases, and a medical nexus, which is a medical link between the event and the diagnosis. That is kind of the 1,000-foot level of basic direct service connection. Right? There's other kinds. There's secondary service connection based on aggravation, service connection based on presumption, and a few others. But direct is the most used type of claim out there. Presumptive service connection takes that nexus and removes it. And it basically provides the benefit of the doubt that the diagnosis is related to the event and service. Okay. Now, however, let me point something else out, especially with the herbicide guys. It wasn't as big of a problem with Gulf War guys. You get a presumption of exposure. Okay. We didn't get into that before, because you need that in-service event, diagnosis, and medical link. Well, yep. Sometimes the in-service event is hard to prove. Not so much with burn pits and Gulf War stuff. They might not understand the exposures, but they know the exposures occurred. But for herbicides, you've got to show exposure to those herbicides. That is really difficult to do in a lot of cases outside the norm where they know herbicides were used.
Yep.
Like Thailand, like Johnston Island, like Guam, and a number of others. Well, this law presumes you were exposed in those locations, and then it presumes that exposure causes a bunch of different diseases on the herbicide list. So in that respect, it does a couple of different things. So for herbicides, there's always been, Agent Orange Act did two presumptions. Most people think it just did one. It presumed you were exposed, and then it presumed a lot of conditions were related to that exposure. Same thing kind of goes for the Gulf War guys, although VA was not really denying claims based on exposure. It was the medical nexus on those claims that was getting everybody.
Yep.
And so, and understand, a medical nexus doesn't have to be rock solid if VA is doing their job right. It just needs
to exist.
It needs to exist, and it needs to be at least in equipoise, which is a balance of positive and negative evidence. And that goes along with all the evidence in the case.
Yep.
So when that evidence is there and it's in equipoise, VA was supposed to have granted the benefit. We all know it just pays lip service to the benefit of the doubt. It wasn't giving it. Doctors didn't understand it. They used a cause and effect test. I mean, we could go on for hours on the problems that existed prior to this act. But this act takes all of that and says, we're going to give you the benefit of the doubt that your condition is related to your exposure.
So let me throw a different scenario out. So let's say that I do have something in my service treatment records, a couple things, and all I can get together is my buddy letter. I file my claim, and for some reason, the VA rater doesn't send me to a C&P exam, and there actually is an equipoise situation. That's what the VA does. They make sure that doesn't happen, and they send you to an exam. Would I win that? Or would my chances be decent? Not a medical nexus, but there's not something on the other side saying it doesn't exist.
You mean, would you win it under the PACT Act?
Yeah.
What's the disability?
Asthma.
If you were in the Gulf, you should absolutely win that condition under the PACT Act.
If you need to appeal your VA claim, check out Hill and Ponton at hillandponton.com. See if they could help you out. Also, if you're at Camp Lejeune between 53 and 87, you may be eligible for additional benefits. Links for both of those are in the description. Don't forget to sign up for my boot camp if you want to learn more about my process, which is the VA claims process. You're going to need medical evidence to win your VA claim. If you're missing a diagnosis, severity of your symptoms, or a nexus, and your doctor won't do it for you, send an email to Second Strata and see if they can help you with your missing medical evidence.